Hi, this is Emilia Banse again, psychiatric nurse practitioner, and in this talk we're going to speak about ADHD, which stands for Attention Deficit Hyperactivity Disorder. Most people have heard of this condition. It's not an uncommon condition. We're specifically going to talk about adult ADHD, just because child ADHD is pretty straightforward and it's usually very easily diagnosed through testing, interviews, etc., and observation as well. With adult ADHD, it's not so clear-cut. Very often in practice, I've seen people come to me with anxiety and depression. However, after thorough interviewing and history taking and identifying different problems that person may be having, turns out that the primary condition that they're dealing with is ADHD. So with attention deficit disorder, as the name suggests, there's a significant problem with attention and being able to sustain focus on a particular task, being fidgety, restless, making careless mistakes, rushing through things, procrastinating, avoiding tasks that require a lot of attention and to detail, interrupting people. That's another sign. When people are talking to you and you frequently interrupt to get to the end of the story, being restless and fidgety, unable to sit through meetings. So an adult might take several bathroom breaks just because they can't sit still, not because they need to necessarily go to the bathroom. Being unable to sustain attention and focus when you're being spoken to directly and having to ask what the person just told you. So these things can be quite impairing and affect a person's productivity and their relationships and their emotional state. And also, I have seen people with ADHD who have previously been diagnosed with bipolar disorder or just generalized anxiety and depression, like I mentioned earlier, but the true issue is ADD. And the two most common conditions with ADD, untreated ADHD, are typically depression and anxiety. Anxiety being more prevalent than depression, but very common with this condition if left untreated. The way that adults are diagnosed is through testing. There's formal testing, which involves questionnaires, a computer test, and the person who's doing the testing observes the person while they're doing certain tasks and things like that. So that would be more formal testing. And more informal testing would be what your primary care doctor or psychiatric provider will do. They'll compare your symptoms to those in the DSM, Diagnostics and Statistical Manual. And they would ask you a certain set of questions, and if you meet the criteria that is set forth by the Diagnostics and Statistical Manual, then that's how you are diagnosed. Sometimes it is very straightforward and very obvious, and sometimes it's more often than not, it's not very obvious. So very careful examination is warranted. So thank you. Please feel free to ask any questions in the discussion section of our website. Thanks.